Hi, this is Dr. Philip Miller. I'm looking forward to seeing you at our consultation. I wanted to go over some rhinoplasty terminology so that we would have a better way of communicating with one another, and so you could very precisely tell me what it is that you don't like about your nose. So let's do the three most common rhinoplasty terms. I'm showing you an individual who has relatively good proportions, that they're actually quite happy with their nose, and then I'm going to modify it. This is the first modification. It is someone who has an over-projected tip. So with an over-projected tip, you want to deproject it. And so you would deproject an over-projected tip. Someone opposite from that is someone who has an under-projected tip. That individual would want to have a projection or project their tip. What about the bridge of the nose? You can have someone who has a hump or a bump, and you want to reduce that bump. Now that's in distinction to someone who says, I want my nose straight. Because yes, I'm straightening the nose from the side here, but usually when we say let's straighten your nose, it's because from the front, your nose is crooked. So you have a little bit of a crooked or a twisted nose from the front, and I'm straightening it in that area. Now the opposite of a hump or a bump is a scoop. So for a scoop, we want to augment. We augment the scoop to give you a straight line if that's what you want. And then the last term that we really should be familiar with is called rotation and counter-rotation. In this individual now, they have a rotated tip. It is overly rotated, that classic pig-shaped nose that people don't want at all. So in here, this is a classic over-rotated tip, and I'm going to counter-rotate it. I'm going to bring it down, as opposed to this individual who has a droop or a ptotic tip or an overly rotated tip. In that case, we want to go ahead and rotate it up. We rotate that up. So a quick review. Here we are sort of at baseline, and then here's someone who has an over-projected tip, someone who has an under-projected tip, a hump, a scoop, an overly rotated nose, and an overly under-rotated nose. So I hope this helps with our communication. Look forward to seeing you when you come in. Take care.